The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and thanks to everyone for listening in. We are celebrating a milestone today. This is the 100th episode of the Healthcare Labyrinth Podcast. We started back on December 22nd, 2023, and have had an episode each week since then. In addition to the weekly podcast, we have a twice-weekly blog, usually Monday and Thursday, and a news feed about the day's healthcare events and commentary from me each weekday. If you haven't checked out our full website, go to healthcarelabyrinth.com. Today's podcast is on the topic of risk adjustment overcoding and data validation audits, known as RADV audits, as well as a recent federal court case where a judge threw out the entire rule governing administration of these RADV audits. Back on August 1st, I did a thorough podcast on RADV, covering what is a RADV audit, what CMS announced in terms of auditing every contract in every payment year, the culprits in the current debate over overpayments and risk adjustment overcoding, and whether those RADV audits would be fair. I will cover a little on the history and overcoding culprits today, but check out the August 1st podcast for more details, as it is still very relevant and has deeper background on the issue. So let's get right to the RADV topic today. We will take our usual 3 breaks to break things up a bit, as I always say. So in this case, with the judge throwing out the ruling, plans may be delighted with the recent court ruling striking the RADV rule, but they should not cheer for too long. That's my admonition on this issue. A federal court has vacated the 2023 Medicare Advantage Risk Adjustment Data Validation RADV audit rule, finalized during the Biden years. The court nullified the entire rule, not just portions of it. The decision was not unexpected. The Biden administration included so many far-fetched and indefensible provisions. At the same time, it is a bit of a shocker, as it throws the Trump administration's plans for a 100% RADV audit commitment into great flux. That certainly raises uncertainty for plans as well. So here's a little background. After years of operating RADV audits through both the Centers for Medicare and Medicaid Services and the Health and Human Services Office of Inspector General without rulemaking authority, the Biden administration finally proposed a sweeping RADV rule under which recoupments in the MA risk adjustment program could be executed. A courageous plan, Humana, the second largest plan in MA, challenged the rule in September 2023 on several very sound grounds. First, Humana argued that the rule was procedurally invalid, arbitrary, and capricious, as well as did not follow the Administrative Procedures Act. Second, there was the lack of a fee-for-service adjuster, a mainstay of prior audits. The adjuster took into consideration relative differences between the risk adjustment processes in the traditional fee-for-service system and Medicare Advantage. Humana argued the fee-for-service adjuster is essential for maintaining actuarial equivalence between the two programs, as the adjuster accounts for the difference in documentation standards used for payments. Traditional Medicare's payment model relies on unvalidated claims data, while RADV audits of MA plans require validated medical record documentation. Third, there was the imposition of extrapolation, where the audit is on a sample of cases, but penalties are calculated across all membership or a portion of membership depending on the audit scope. Humana argued the extrapolation certainly could not be applied without a fee-for-service adjuster, as it would violate the actuarial equivalence principle by holding MA plans to a higher standard than fee-for-service Medicare. Humana also said the extrapolation would lead to financial instability and dramatically increase MA plans' financial risk and liabilities from audits. This would undermine the ongoing stability and predictability of MA. Fourth, there was the retroactive recoupments issue on years long closed. The rule called for recoupment back to payment years 2018. Humana argued this retroactive application was illegal, as it would create significant and unforeseen costs for MA plans, and that plans legitimately relied on previous guidance regarding recoupments. With that, we will take our first break, and when we get back, we will talk about the judge's ruling in the case. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you are enjoying this episode of the Healthcare Labyrinth Podcast. It's our 100th episode. We're talking about a recent federal court decision that throws out the so-called RADV rule. This promises to upend plans at CMS to conduct major audits in the area. Let's talk about the ruling. The decision here perhaps rivals what occurred in 2024 on star ratings when a number of plans challenged CMS on guardrail application when the Tukey outlier formula was introduced. These plans said CMS ignored existing rules. Courts agreed. The court in the RADV case found that CMS did not follow the procedural requirements of the APA, the Procedures Act, as well. There were inadequate notice requirements. CMS did not justify its decisions via the comment period either. Because of the potential harm to plans, the court vacated the rule entirely, even though it did not decide on many of the specific arguments from Humana. Let's talk about the fundamental inequities that was in the rule by Biden. The harm really would have been pronounced via both extrapolation and retroactive application. On retroactive application, books are long closed for prior periods. Plans never even had a chance to reserve dollars for potential recoupments as the new rule was published years later. Paying such penalties without reserves would come out of benefits, cost sharing, and access in the program. Indeed, CMS said the rule would result in insurers returning $4.7 billion to the agency between 2023 and 2032. I would argue the amount would have been much greater with the new targeted 100% annual audit approach the Trump administration announced. Indeed, government and private estimates suggest overpayments are in the tens of billions annually. I also have questions about extrapolation. I do not argue that government should not be allowed to do focused audits and potentially use extrapolation to ensure integrity in healthcare. The problem is that the extrapolation methodology should be part of the rule, have had public input, and be fair and reasonable. The Trump administration's 100% RADV audit announcement failed to scope or disclose the methodology as well. Further, the Trump administration seemed to focus its audit plan on the codes at the highest risk of abuse. The approach was not vetted publicly, and plans deserve answers on how recoupment is impacted by multiple and ongoing focused audits versus fewer comprehensive ones over time. So why did the government want to go to 100% RADV audits? I told you I went into details on the issue of risk adjustment overcoding in the August 1st podcast, but there is a new risk adjustment study that ties very much to earlier findings that explain why CMS went here with RADV audits and could lead to momentum to pass other reforms. Many studies paint MA overpayments with a broad brush, saying the entire system is over-reimbursed. But the new study backs up something I have said for a long time, that a small number of larger MA plans receive a disproportionate benefit from these RA overpayment schemes by using aggressive or even fraudulent coding. The study by the Alliance of Community Health Plans, a group that represents local and regional nonprofit payers, finds something similar to a few other studies that have zeroed in on the real culprits giving all of MA a bad name. ACHP's study finds that United Healthcare, the biggest MA insurer, collected up to $785 more per beneficiary than local nonprofit plans in 2023, costing Medicare more than $6 billion in excess payments that year. Humana, the second biggest MA player, collected $423 more per beneficiary that year than if those members were in ACHP member plans, costing Medicare an additional $4 billion. United Healthcare's average risk scores were 36.2% higher, and Humana's were 19.2% higher than nonprofit health plan members of ACHP. Earlier studies show annual overpayments for United were $14 billion in 2021. With that, we will take our second break, and when we get back, we will talk about the impact of the court ruling moving forward. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you are enjoying this episode of the Healthcare Labyrinth Podcast. It is our 100th episode. We're talking about a recent federal court decision that throws out the so-called RADV rule. This promises to upend plans at CMS to conduct major audits in the area. So let's now get back to the impact of the court ruling moving forward. In my mind, the court decision pretty much throws 100% risk adjustment audits under the Trump administration out the window right now. This is very problematic for CMS Administrator Dr. Mehmet Oz. Indeed, in two recent appearances, Oz has pressed the overpayment issue hard and seemed to leave open the possibility of implementing aggressive audits despite the ruling. After all, at his confirmation hearings, he promised to go after the overpayment issue. I think audit recoupments would easily be challenged in court by plans based on the fact that no rule to conduct the audits now exists. I do not think CMS can carry out such far-reaching audits on general regulatory authority, especially with extrapolation and other features. The agency certainly cannot recoup for prior years unless there is evidence of fraud or other legal violations. While I am a supporter of CMS overall, the STAR lawsuit I mentioned before and this one show how regulatory agencies can become too powerful and ignore procedures and due process. It is important for plans to push back, as they did with the STAR suit and risk adjustment audits. While the Trump administration could appeal the court decision, it seems pretty clear that the appellate level or the Supreme Court would likely side in whole or part with the district court. We are now in a post-Chevron world. The Supreme Court's decision in that case was far-reaching and stripped agencies of almost all discretionary authority in rulemaking. What should plans think? Well, plans can spend a little time breathing a sigh of relief, but Oz's commitment to Congress and the growing momentum to reform MA overpayments needs to worry plans just the same. There is little doubt that CMS or Congress will in time implement something far-reaching. I do expect CMS to move another rule forward to give it substantial, or at least reasonable, authority. That would clear the way to move forward with audits after a brief stall. So, MA plans should see this only as a brief respite. The court ruling also opens up some ugly prospects. For example, a small number of large plans have risk scoring practices that are outliers, and these plans generate a disproportionate share of the suspected overpayments. But now with audits in limbo, Congress or CMS now could push reforms that apply universally to save money on overpayments, including increasing the coding intensity negative adjustment for all plans in the rate-setting system. This would cripple smaller and regional plans that do not have outlier risk adjustment practices or patterns. With that, we will take our last break, and when we get back, we will talk about what plans should do next. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you are enjoying this episode of the Healthcare Labyrinth Podcast. It is our 100th episode. We are talking about a recent federal court decision that throws out the so-called RADV rule. This promises to upend plans at CMS to conduct major audits in this area. Let's talk about how plans should approach the issue. First, plans should consider reform of risk adjustment scoring practices internally if needed. The new risk model V28 already will reduce overpayments. My view is CMS or Congress will go after scores that are derived solely from manual chart reviews or health risk assessments. Thus, investigate if your plan's practices are too aggressive, assess overall recoupment risks, and reform practices if necessary. Second, take the time to establish clear audit and documentation procedures. Establish mock audits with providers as well as proactive documentation year-round. Educate providers on correct coding in the audit processes. If it is true that some plans abuse risk adjustment coding, it is also true that some plans may actually undercode their populations. Third, join STARS gap closure and risk adjustment data collection together. It makes a great deal of sense. Fourth, if you are notified of a payment year audit, you have no choice but to comply with filing documentation, even as you consider legal recourse, because there is no rule in place. Fifth, have the courage of Humana to challenge CMS if you believe the agency continues not following the Procedures Act and the audit standards published are unreasonable. They certainly are if they continue to look anything like the 100% RADV methodologies in place right now for payment year 2019. Sixth, consider advocating for reasonable risk adjustment reform, including disallowing risk scores derived solely from manual chart reviews or health risk assessments. This with ongoing model changes and using 2 years worth of diagnoses versus 1 in each cycle should lessen overpayments dramatically. As well, push for instituting a data-based and fair interim, plan-specific added coding intensity adjustment instead of increasing the negative adjustment universally. This could provide savings relief in the short term, but not hurt those smaller and regional plans that don't engage in overcoding. This would better pull revenue from the true outlier plans. As I say, a small number of bigger plans with suspected aberrant coding practices are giving the entire MA program a bad name. Ironically, that seems to include Humana as well. But maybe the new leadership there understands what is at stake overall. The industry as a whole should focus reform on the outlier plans so as not to further destabilize Medicare Advantage. Congress and perhaps CMS need to be educated on this as well before they implement radical one-size-fits-all changes. In many ways, a fair and equitable RADV audit system is one of the better permanent ways, along with HRA and chart review bars, to police bad behavior. So, work with CMS on rolling out a new and truly accountable rule. Get comfortable with some of the extrapolation and recoupment policies and advocate for a smooth glide path to implementation so as to protect financial stability in the short term and prepare for the changes. This avoids more political reactions and curbs the usual off with their heads political approaches we see on Capitol Hill. With that, we will conclude this edition of the Healthcare Labyrinth Podcast. We will see you next week as we undertake our 101st episode. Take care.
Thanks for joining Mark and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.